Hello everyone. Today I'm going to talk about treatment of COVID-19, new coronavirus by TCM. So I think you heard about TCM a lot because this method, traditional Chinese medicine, already known worldwide. The big difference of Chinese medicine and the Western medicine is Chinese medicine, they do a kind of diagnosis, TCM diagnosis, then they decide the syndrome and they treat the syndrome. Although they do not know the name of disease, or although they didn't analyze the chemical composition or chemical characteristics of virus, they still can see the symptoms and then they know what to do. So now, the medication for coronavirus, the new coronavirus, we do not know yet. So they are making a research on this because now we do not know what to do, what kind of medication is good for coronavirus. So we can look the traditional medicine, the ancient medicine, because ancient people they had a lot of experiences this kind of disease. From the ancient time, the mankind, they accumulated a lot of experience about epidemic diseases, because epidemic disease was very important in ancient time. Most of people died for this. So actually they have some experience. So it is worth we pay attention. It is worth paying attention on it. We cannot ignore totally the ancient people. It is too, how can I say, primitive and too, what is, yeah, you can say that, but from the record of the ancient times, we can find some good tips or some hints about how to treat the epidemic disease. In China, they use the TCM, traditional Chinese medicine, and the Western medicine at the same time, because they find if both used together, the effect, how can I say, the medication or treatment becomes more effective. Okay, so I'm not saying that TCM is the only way, or I'm not saying that Western medicine is the only way. So I'm saying that we have to use all methods that can complement each other. Okay, so let's look. They decided about this coronavirus, the new coronavirus. They decided that it is a pandemic pathogen of humidity and coldness. In another word, cold humidity. So how they decided? They observed the symptoms, how this disease develop, how it changes. They observe it, and then they decide. Okay, it is not from the chemical analysis. It's simply by observation of symptoms. Okay, so what does it mean, the cold humidity? Humidity means in Chinese medicine, if pathogen of humidity enters the body, usually have a digestion problem. In another word, it's called a middle burner problem. Okay, and cold. So usually can have cold symptoms. The patient can feel coldness, whatever. Okay, so observation of symptom is very much important. One point, this video is for medical doctors who knows Chinese herbal medicine and who understand how to use it for clinical use, or traditional Chinese medicine practitioners. So if you didn't study TCM at all, then this video can be a little bit difficult. But at least you can watch this video, and then you can take some good point what to do. Okay, And the next video is I'm going to film a prevention, about prevention. So the prevention part will be for everybody. Okay, this video is for treatment. So I hope many medical doctors or therapist who is doing the job for the COVID-19 can watch this video, and I hope this content will help. So let's look. There is a TCM classic, the classic of TCM, the one book, a classical book. The name is Wenbing Tiaobian. The Chinese name, Wenbing Tiaobian. Wenbing means the worm disease. Okay, Tiaobian means commentaries. Okay, so this book was written by Wu Jitong, exactly Qing Dynasty in China. This book is Wenbing Tiaobian. Okay, so this book he made a various research on the worm disease, and worm disease is a kind of epidemic disease also, but symptoms can be mainly the worm symptoms. So in this book he commented and criticized and corrected various errors of the previous books, and he wrote some chapters about cold humidity. So chapter 4 in the part of superior burner, chapter 3 in the part of lower burner, chapter 8 in the part of miscellaneous disease. So if you read that part, you can understand the characteristics of pathogen of cold humidity. Okay, the names of herbs here are written in Chinese pinyin, and if you need, you can look for the botanical names or academic names by Google. Okay, but I don't think it is very much necessary to find those academic names. But some people curious can look for it. Okay, most of herbs and formulas can be found in United States or Europe. Okay, you can buy it in the internet site. In TCM, this disease, COVID-19, the stage divided into the 4 stages. No, actually it's 3 stages: initial stage, and progressed stage, and recovering stage. Okay, so the initial stage means very light. It's not serious yet. Okay, it just began. Okay, or the symptom doesn't bother the patient a lot. So the initial stage is a kind of light situation, and progressed stage is dangerous situation. Dangerous. So the patient can have very high fever, or how can I say, to lose consciousness, or can have a difficulty in breathing. So in Western medicine they say cytokine storm. Cytokine storm happens, and then the patient cannot. It bothers the breathing process. So patient can die for this, correct? And recovering stage is when patient doesn't have fever for 3 continuous days without any medication. Okay, we call it a recovering stage. Okay, the initial stage can be divided into 2 types. One is with fever, the other is without fever. Okay, let's look at the initial stage with fever. The first syndrome is cold humidity lung. So here I'm saying that the word syndrome. Okay, syndrome is like this: something that some paragraphs that explain the cause of disease and how to treat. That includes, okay, like a cold humidity blocks lung. So it means situation have a characteristic of cold humidity, and how to treat? Yes, you have to warm or expel the coldness and transform humidity. That will be the principle of treatment for this syndrome. Okay, I think if you studied TCM, you already understand what I mean. So from now on, I'm not going to explain too detail, okay? Because I assume you are TCM practitioners. I'm going to pass very fast, okay? I hope you understand it. Because it is not a TCM course. It is a kind of introducing the method, okay? This syndrome has some symptoms like fever or dislike coldness. Yeah, patient doesn't like coldness because the cold pathogen entered. Patient have coughing because it is blocks lung, so automatically can have coughing or phlegm or white phlegm, heavy chest. Yeah, this is all about phlegm in the chest, in the lung. And also when humidity enters the body, it makes a movement of qi. So qi is blocked in the chest, so patient can feel heavy, and the chest feel heavy and tired because humidity interferes the functions of the spleen. So when spleen doesn't work very well, we feel tired. And there is another description can be heavy body. The body feels very much heavy, okay? And muscle pain, qi blocked, and bloated abdomen. I already said that the humidity symptom usually have a middle burner problem. Middle burner means our digestion problem, or stomach, spleen, or that is the middle burner. Okay, so patient can have a bloated abdomen, difficulty in digestion, or no appetite. So doesn't like to eat because the digestion problem, the digestion system is not working very well. Okay, diarrhea. The patient can have diarrhea. Okay, tongue. The color of tongue can be pale tongue and a little red. It means the color of tongue is usually normal. Okay, it means this pathogen didn't influence internally, so it didn't change the color of the tongue yet. So the color of the tongue is still normal. White coating. It is white coating and fine grains of coating. The coating, tongue coating has a lot of grains, you know. If you use the microscope, you can find a lot of grains there. And the fine grain means humidity. And white coating, it is not heat. Okay, white means. So now you can understand the symptoms and tongue. So pulse is deep and soggy. Okay, let's look how to treat this. In TCM formula, this is herbal medicine. Okay, 藿香正气丸. In another word, 藿香正气散. Okay, same thing. One is a kind of how can I say, pilula. Okay, san is a kind of powder. Okay? This is just about the form of administration. Okay, so 藿香正气丸 is classical formula in herbal medicine, and it is easy to buy. It is not rare. You can buy it in the TCM shop or herbal medicine shop. It's not difficult to buy it, or internet site you can find it. And also you can find the ingredients of this formula by Google, by internet. Okay, if you are interested, you can look for it. This formula transform humidity and warm the coldness. So expel coldness. Okay, Anyway, if you cannot find this formula, 藿香正气丸, yeah, you can buy each ingredient of 藿香正气丸, and then you can boil it to make a decoction, and then you can take it. Or I wrote here the recommended herbal decoction. So it is also a kind of decoction that you can use. Okay, so 마황 6 gram, 창주 processed 15 gram, etc., etc. So I'm not going to explain all of these ingredients here. Okay, but if you look at the ingredients, this is about 마황 is making sweat and expelling wind cold from the external layer. Correct? And 창주藿香is transforming the humidity. So this herbal decoction is exactly expelling coldness and transforming humidity and regulating the digestion. And the last one, 생ren. This is how can I say, for lung, to calm the coughing. Okay, let's look at the next syndrome. This is still initial stage with fever, but this case is warm humidity blocks lung. So in China, they decided the pathogen of coronavirus, the new coronavirus, as cold humidity. But why here warm humidity? This syndrome name is just a description of situation. So perhaps this patient, constitutionally, the body has more heat than coldness. So when pathogen enters the body, the pathogen can transform to warmness, because of the body has heat. Do you understand? So it is possible, although the pathogen usually makes coldness, but for this case, for this patient, it can show the symptoms of warmness. Okay, to look at the symptoms. Symptoms are mainly about more warm than cold. Okay, like a high fever. It is not exactly high fever, but a little high fever. Okay, it means the fever is higher than the cold humidity case, the previous case. Okay, and the patient can feel internally body hot. Okay, or less coldness, and other symptoms are very similar to the previous one. Okay, short breathing after movement, or tired, dry mouth, because warmness maybe it dried up the liquid, fluid in the body, and no appetite, etc., and dry faces or constipation, because this warmness dried up the liquid in the body. The faces becomes dry or constipation. Okay, yellow urine means heat. Okay, tongue began to have more heat. Okay, like a yellow and thin coating, or yellow but fine grains of coating. It just means that the warm humidity. Okay, pulse is slippery and rapid. So rapid, slippery is exactly the warm humidity. Okay, TCM formula. 3人合剂津液百度颗粒藿香正气丸. Okay, so here 3人合剂 and 津液百度颗粒, these two formulas are modern patents formula. So this is the modern company of China. They invented it. This is not a classical formula. Okay, but I think it is not easy to buy it. It is not easy outside China, because this is a modern patent. Okay, but 藿香正气丸, you can buy it outside China easily. Okay. Okay, from the names of these Sannan Heji and Jinye Baidu Kli, we can guess maybe this is cooling the heat and maybe disintoxicate. We cannot know the ingredients because these ingredients are secrets, because it's a patents, modern patents. Okay, the classical one we can know the ingredients. We can Google it. Anyway, if you cannot find it, if you cannot buy it, you can use the recommended herbal decoction as below. 杏仁、白豆蔻、薏仁、半夏、陈皮, etc., etc. These herbal medicines are all for cooling the heat and transforming the humidity. Okay, let's look at the next syndrome, the third one. Still initial stage with fever. Pathogen is at the Shaoyang layer. So when pathogen is at the Shaoyang layer, the typical symptom is heat and coldness are alternating. So alternating heat, alternating coldness. Okay, this time is heat, this time is cold. This time is heat, this time is cold. It's alternating. Okay, this is typical symptom. So if you find the patient has this alternating fever, you can think probably the pathogen is at the Shaoyang layer. But sometimes it is not very clear. Some patients can have more cold and a little fever. The fever and coldness is not that clear. So this symptom is not that easy to diagnose. Okay, I confess this is not easy. Coughing, these symptoms are all same with other syndromes. Phlegm or less phlegm, heavy chest, tired, bloated abdomen, no appetite, yellow and short urine or diarrhea. Okay, tongue is like this, like white and fine grains of coating or vellus column. Pulse is usually slippery. Okay, let's look how to treat it. TCM formula is Chaihu Kofuye. The name is very strange, but this is simply the extract liquid of Chaihu. Chaihu is a kind of herbal medicine. It's a kind of herb. Okay, so if you cannot buy it, you just use Chaihu. Okay, with Huoshang Zhengqiwan. Okay, so you can add Chaihu with at the Huoshang Zhengqiwan, and then you can take it. Recommended herbal decoction can be Chaihu 12 gram, Huangqin 12 gram, Bansha 10 gram, Dangshan 10 gram, etc., etc. So these ingredients, if you look, this is very familiar, isn't it? This formula is Xiao Chaihu Tang. This formula recommended herbal decoction is a variation of Xiao Chaihu Tang. Okay, Xiao Chaihu Tang. 藿香、草果、陈皮、茯苓、杏仁、猪乳、树叶. So it's very much looks like 藿香正气丸 and 小柴胡汤combination. It looks very much similar. Correct? Okay, let's look at the next syndrome. This is the initial stage without fever. Okay. So first syndrome of this stage is humid epidemic pathogen blocks lung. So this syndrome is just humidity. Okay, it doesn't say about cold or warm. Okay, that's why it doesn't have fever. Okay, this is humid, more humid. Okay, so symptoms are normal body temperature. So some people doesn't show many symptoms. Correct? No symptoms. But sometimes coughing without phlegm or a little phlegm. This is very light situation. So most of people think it is okay. I don't have coronavirus. They don't think anything about coronavirus in this case, correct? Because the symptom is very, very light. But some people can have a heavy chest, and then they think a little bit. They begin to worry, correct? Short breathing after movement, or tired. This is very similar to previous cases, correct? Sweating during daytime and palpitation or no appetite. So the humidity is interfering the digestion functions. So that's why this patient have no appetite. The tongue is pale and red color and white coating or a little fine grains of coating. So the tongue it can be looks very much normal. Okay, it's not easy to differentiate only by tongue in this case. How to treat it? The TCM formula is 藿香正气丸 with weeping feng san. So weeping feng san is widely used for prevention method. Okay, in the video of prevention, I'm going to explain about weeping feng san. Okay. Weeping feng san is also classical formula, and you can buy it very easy. Okay, most of the herbal medicine shop, they sell it. Recommended herbal decoction is 마황, 장주, 이른, 호샹, etc., etc. So it is very much similar, correct? Similar to cold humidity, correct? But here they use 당션 or 른션. This is tonifying qi, okay? And gualopi. Gualopi is transforming the phlegm. The progressed stage, this is dangerous situation. I told you the patient can have a difficulty of breathing, or even they can lose consciousness, or delirium, or coma, or they have danger of death. So usually the patient has to be internated. Okay, the patient has to be in the hospital. Okay. And the medical doctors, they have to observe the patient all the time. So when you are confirmed as coronavirus cases, you need to maintain the contact with hospital for emergency situation, because the COVID-19, the development of the disease is very fast. So, for example, 3 days ago confirmed, but only several days after, it can develop very fast and can arrive this stage, like a progressed stage. So the patient can have a high fever and very become very dangerous. Okay, nobody knows what is going to happen. The first syndrome is toxin or pathogen dominates lung. So toxin means this pathogen is very dangerous. Okay, the symptoms are high fever, continuous, feel very cold before fever, and fever diminish with medication. Okay, coughing, yellow or white phlegm, heavy chest, short breathing. These are same. Okay. Asthma with movement, no appetite, etc., etc. Okay. Tongue is a little bit extreme tongue color, like a dark or yellow coating. It means very much heat. Yellow and dry coating, white coating. White coating is coldness, and fine grains of coating is humidity. Pulse can be slippery. This case can be two kinds of extremity. One is heat, one is cold. Hot or cold. Okay? So the toxin or pathogen can transform to extreme heat or extreme cold. In case the humidity transforms to heat. This is extreme heat, okay? And number B, the humidity transforms to extreme coldness, okay? So the two extreme cases can have. If humidity transforms to heat, it can have a high fever and yellow phlegm, blood in coughing, blood, okay, bleeding, or mouth dry because all heat, okay, constipation, etc., etc., and pulse becomes very rapid, okay. If it transforms to coldness, fever is not very clear, okay. And white phlegm, diarrhea, and they don't drink much water because of humidity and coldness, and dark tongue color, it is extreme cold, okay. White coating, a deep and slippery pulse. In case humidity transforms to heat. TCM formula, there are a lot of formulas. 莲花清瘟胶囊 金花清肝胶囊 CN ping injection 清开灵 injection. So these formulas are all modern patent formulas. So I don't think you can buy it outside China. Okay, but if I explain the principle of treatment is they are cooling extreme heat and desintoxicate and open the orifices to make the consciousness come back. Okay. So here I wrote injection. So in China they use extract liquids of herbal medicine and then they inject to the body. So this is very typical Chinese method. I don't think outside China if it is legalized. I'm not sure. I don't think it is legalized outside China, but so this method is used only in China. Okay. Okay, you cannot find these formulas, but you can use recommended herbal decoction like Qinghao, Huangqin, Shigao, Zhebeimu, Banxia, etc., etc. These herbal medicine are all cooling heat, desintoxicate, and open orifices. Okay. Okay, let's look at the humidity transform to coldness. Herbal medicine formula is Huoxiangzhengqiwan. You can buy it, okay, outside China. Suhexiangwan. Suhexiangwan is opening the orifice in case of cold pathogen block the pericardium. So Suhexiangwan is usually used for the, how can I say, the stroke situation when the cold pathogen block the orifice and then patient lose the consciousness. So they use Suhexiangwan. Okay, Suhexiangwan is a classical formula you can buy outside China also. Okay. Okay, recommend herbal decoction. Renshen foods. Renshen food is used a lot as a combination when emergency situation, like a patient lose consciousness because of collapse of qi, or lose qi, or lose yang abruptly, and then the patient can become unconscious. Correct. So the heart beating becomes very slow, and the patient is dying. They lose the temperature and dying. This kind of case, the Chinese medicine use renshen and foods. Renshen is kind of ginseng. Yeah, it's a Korean ginseng. Okay. Yeah, Korea is famous for ginseng quality. Correct. Mahuang, Guizi, Xingren, Huoshang, Yiren, etc., etc. Okay, let's look at the next syndrome, next pattern, that is blocked internally and collapsed externally. So this is also a kind of very progressed stage and very dangerous. Symptoms are usually a very high fever or without fever after taking medication. Okay, and very heavy chest, difficult breathing, very much difficult to breathe. So the patient can have danger of death. Asthma with movement or need to use ventilator. The patient has to use a ventilator in the hospital. Okay. No appetite, of course. Very tired and diarrhea, coma or delirium, lose consciousness. Very much nervous, sweating. As patients sweat, the more patient lose qi and become more tired. And hands are cold. Okay. Tongue is purple and dark color. This purple and dark means extremity. Okay, extreme. So thick and fine grains of coating or dry. Floating and grand. The pulse is floating and grand, but without root. When pulse doesn't have root, this is a sign of danger, very much danger. TCM formula: 水必精 injection, 生福汤 injection, 生脉饮 injection. 生福汤, this is Renshen and foods. As I already commented about this, this is used for emergency situation, like a patient lose consciousness and collapse of qi, the heart beating is dying, the lose temperature, body temperature, etc. Shengmeiyin is used for deficiency of qi and yin. So Shengmeiyin can tonify qi and yin and nourish the liquid. Okay. In China, they use it as injection because the patient lost consciousness and they cannot drink the decoction actually, and also the digestion system is not working very well. So this progressed stage usually they use injection or intravenous injection. Okay. Recommended herbal decoction usually use Renshen foods, Shanjuyi, Maidong, Taoren. Okay, this is tonifying qi and yin and liquid. Okay, and Suhe Shangwan. This formula is for opening orifice. Angong Liuhangwan is also can be used to open the orifice to recover the consciousness. Okay. Recovering stage, I already told you, at least 3 continuous days the patient doesn't have fever without medication. So we can say this is recovering stage. The patient is recovering. The syndrome is deficiency of spleen and lung. So it includes deficiency of qi. TCM formula is used like Buzhong Yi Qi Wan or Buzhong Yi Qi Tang with Shenmai Yin or Shenmai San. Okay, Buzhong Yi Qi Wan and Shenmai Yin, they are all classical formulas. So you can buy these formulas. It's not difficult. Okay. So Buzhong Yi Qi Wan is tonifying spleen, qi of spleen, and qi of middle burner. Okay, Shengmai Yin tonify qi and nourish the liquid of the body, and tonify qi, nourish yin and liquid of the body. Because of fever, because of fighting with pathogen, the patient lost a lot of qi, a lot of energy, and a lot of liquid. So that's why we are tonifying with these formulas. Remember, if the patient is not deficiency, and if you tonify the patient with 부종이치환 or shenmai, the patient can become worse. The situation can become worse. Do you understand? So diagnosis to confirm, oh, this patient is in deficiency clearly, and then you can use this formula. Okay, so be careful. If no appetite and diarrhea, you can use 香下六斤之丸 with 50巧克力. Okay, 香下六斤之丸, it is regulating the middle burner. Okay, so it is very good for diarrhea or lose appetite. Okay, and also tonify spleen. 香下六斤之丸 you can buy outside China. This is a classical formula. Okay, 50巧克力 this is a modern patent. Okay, modern patent. Okay, recommended herbal decoction is like 半夏、陈皮、当参、黄芪. 黄芪 is a tonifying qi a lot. 当参 and 黄芪. Okay, Fulling Sharon is regulating the middle burner and transforming humidity. Correct. And 白术、桔梗、白鹤、千胡、甘草, etc., etc. So this herbal medicine is tonifying spleen and lung, and how can I say, nourishing the liquid and in. Okay,